as you can see, group retiree solution. Let me talk to you for a moment about what group retiree medical is. We have a lot of questions. Well, there's group Medicare Advantage, there's group Medicare supplement products. How do these differ? Why should I use this over those programs if that's something you're currently using? And just to give you some a little experience in what we see in the marketplace around us when we go into these small and large groups, is that usually you're looking at, let's say, a group Medicare Advantage product, which in many cases will be a very high-cost option. They're going to go in and they're going to price those products based on that group, based on their usage, both from the medical side as well as the prescription drug side of things. Then that group is obviously going to be dealing with other Medicare Advantage type items such as deductibles, copays, networks. And so you start to see a program that's being brought in for a solution, and in many cases isn't the best solution for both the end user as well as the group themselves because of the cost factor. So we see that, not necessarily being so much of our competition, but it does exist, and groups are looking at those programs. Then we come to a group Medicare supplement product. Well, if you're familiar with Medicare supplement products, you know that Medicare supplement products, as they're filed, are filed in each state, and they're filed according to the letter plans, other than maybe a couple of states that don't work off of those letter plans. But for the majority of us, those are going to work off of the letter plans. So you're going to see a C or an F or a G. Well, again, then you're confined to the constraints of that particular letter, the filing, and for that particular state. So as you see rate increases occur, again, those are going to be filed on a statewide basis for that particular group. So again, not always a perfect fit for the group. Then you come to group retiree medical. Now, when we go through this and you'll essentially see the benefits, you'll learn that this group retiree medical works very similar. It looks just like a Medicare supplement product, and that's essentially what it does, is it supplements Medicare. So the individuals you're talking to who would be eligible for this group will have Medicare Part A and B, and this would be their supplemental program. But it's called a group retiree medical because of the way it's filed. So it's filed using a trust. That trust is a national trust that essentially houses everyone who's eligible and who enrolls into this program. Because it's filed as a group retiree medical, we also don't have certain constraints like the letter plans. So this product can be filed with multiple benefits, deductibles, copays, no copays, and a whole host of other benefits and services because, again, it does not have to follow the standardized or modernized Medicare supplement benefits. So that's where group retiree medical is much different, as well as if there are a need for rate increases or when they look at that claims loss ratio, they're going to look at that on a national scale and not on a state-by-state basis. So another important item when we get into the rates and the persistency as well as, the future rate increases, which is obviously important when you're dealing with a group. So let's go a little bit further here and talk about who MBA is, who Senior Choice is. So Senior's Choice is the name of the product that we're talking about today. MBA is the company that owns this, Merchant Benefit Administrators. They're out of Phoenix, Arizona. They also own the trust that this is that makes this whole product even work this way. And they are also the TPA, so they take care of all of claims and everything else, commissions and so forth. Now, because they are not an insurance company, they do use an insurance company to for their paper and to file this product in their approved states, as well as to reinsure this product. So currently it is being underwritten and has been underwritten, I want to say for the last 5 or 6 years, by GTL or Guarantee Trust Life out of Illinois. So today's discussion, again, we're going to talk about some of the highlights a little more in depth. We're going to talk about the details on the plan benefits. We're going to talk about the embedded vision and hearing, dental vision optional benefits, their standalone Part D. We're going to get into TEF or non-TEF for just a little bit, and then we'll get into the enrollments. Now, some of this we're going to move through pretty quickly, again, because we want to make this just a very quick highlight of the product, how it works, why it works, why you should be using it, and then essentially for future, more in-depth training, we're going to be doing other webinars, we're going to be doing other live sales events all over the country, or we'll be talking to each and every one of you on a one-on-one basis to answer your particular needs or questions. So plan highlights. These are some of the key ingredients to this product. You've got guaranteed acceptance, nationwide coverage. So again, just like a Medicare supplement, you don't have to work within the constraints of a network. There's no in-network, out-of-network benefits. It works just like a Medicare supplement. Medicare is the primary. This picks up the remainder. So in that sense, there's no referrals, any doctors, specialists, hospital, first-day coverage for pre-existing conditions, embedded vision and hearing discounts, optional benefits, which we'll talk about in a moment. There are multiple plan designs, which we'll get into more detail. The spouse is eligible for coverage, so they do not have to go through underwriting. These groups are also very simple. When a group is set up and you take an enrollment, essentially you just have to put the group number on the enrollment. That person is automatically attached to that group. There is no proof that that individual is a member of that group in some way or another. There's no proof that the person had worked for that company at one point in their life, or that they're a spouse of somebody that worked for somebody at that company. Let's say the spouse is deceased. The wife would always be eligible for this program as well. So very simple to get persons enrolled. Comprehensive Part D coverage, which we'll talk about, which has no coverage gap, and this will go down, as I mentioned earlier, to as small a group as one life. So one individual, one person enrolling is enough to set up a group under this program. The Senior's Choice plan design in a little bit more detail. So no lifetime maximum. It does cover the Part A and Part B deductible. Okay. It also has excess coverage. It does cover skilled nursing up to 100 days, foreign travel emergency, no networks, pre-existing conditions, and nationwide coverage. So if you take those benefits and you compare it to what you may know in the individual Medicare supplement market, you can tell that that looks very similar to a Plan F. So that's essentially how this could be looked at. Now, again, we have some benefits that could be maneuvered around and changed according to the person's needs and budget, but if you went with the zero deductible, zero copay plan, you would be looking at what would be very similar to a Plan F. Here are some of the deductible options. This is where it makes the program a bit more flexible. We can take it from a zero deductible on up to a $4,000 deductible. And there are, I believe, 12 deductibles in between. So you're talking deductibles as low as $100, $250, $500, again, all the way up to $4,000. Now, the nice part about deductible under a Medicare group retiree medical product is Part A and B always operates first. So this deductible, kind of like a high deductible F, becomes a little bit more like a maximum out of pocket. So Medicare is going to pay their portion. The remainder is going to be left over, applied to this deductible. And then once the deductible is met, then the person would, of course, have full coverage from their Medicare as well as their Senior's Choice product from that point forward. The group sponsoring it can make and it doesn't matter the size of group, that group can make any one of these deductibles or copays available to their group members. So that means if you had 50-person group, each one of those persons could elect for a different deductible or a different arrangement of benefits. So again, it becomes very, very flexible. And again, the nice thing about these deductibles is now you can adapt the product to the individual's needs. It doesn't just have to fit for the entire group. You can take it all the way down to the individual, their spouse, make the product work for them, both from a benefit standpoint as well as a premium standpoint. Just to give you some rate ideas, we might talk about this a little bit later, but if you went with a zero deductible, zero copay, you'd be looking at premium, depending on where you're at in the country, very similar to a Plan F, so maybe $130, $140 a month. If you're looking at something all the way up to a $4,000 deductible, your premiums could be as low as $20, $25 a month. So again, this program is very affordable, even though it's built on a group chassis. It does have some embedded vision benefits. We're not going to spend a lot of time on this. Again, this is just included into the program, so there are some discounts available. We could provide you more information on those if you have some specific questions or needs. Same thing with the hearing benefits. So again, this is built into that premium. This is free of charge, and it does work well for individuals if they're needing to go for testing, audiologists, and there are some additional savings built in for hearing aids. Okay, here are some of the add-on benefits that are available under this group. So again, this is what makes it distinct and different from the other markets we talked about or other products we talked about earlier. So we have the comprehensive wellness benefit. Now that's going to give you up to $250 per calendar year for items like acupuncture, for massage therapists. So now the cost of this is very low cost benefit. So if you do the math, ultimately, this benefit might cost you $125 a year, but you're ultimately getting around $250 in benefits. The one thing with each of these optional benefits, if the group elects to add one of these optional benefits, then those optional benefits would have to be taken or would be included on every individual enrolling into the program. So just keep that in mind. There is some private duty nursing benefits. So you can see here it would pay $100 per 8-hour shift, 30 shifts per calendar year. At-home recovery benefit. So that would have to be certified by a doctor, meet the Medicare eligibility, but there is some added home care benefits here, and also skilled nursing. So this is very unique. You're going to see the opportunity to add an additional 264 days or 65 days to your skilled nursing. As you know, currently Medicare pays the first 20 days, and there's a copay from days 21 through 100. That would be the person's responsibility, but most supplements will take care of that 80 days, where this benefit, for a very low cost, I want to say it's $5, $6 additionally a month, will take it all the way out to 365 days. Now, keep in mind, for the at-home recovery skilled nursing side of things, there's no underwriting. So if somebody had a concern, and maybe they had a concern because they were in a situation where their health had declined and they may need some assistance, they can get these added benefits without having to go through any sort of underwriting. We do have one question. Let me see here. Is it available in all states? Can we implement the plan at any time? Open enrollment not a factor. So this product is available in, I would say, about 40 states. Now, just to clarify and take it a bit further, it all depends on where the group is established. So it just has to be approved in the state where the group is setting it up. So let's say, for example, it's not available in New York City, for example. But a member could live in New York as long as the group has been established in the state where it's approved. So we're here in Michigan. So a group gets set up in Michigan. Somebody, part of that group, is in New York. Yes, they can have this program, but we just couldn't establish a group in New York. We can also be pretty flexible with this. So, for example, if a organization, association, whatever, had multiple offices across the country, and you were looking at those various offices, you would just want to pick a state where one of those offices were at. The trust participation agreement just has to be signed in that particular state. As long as it's signed in that state where it's approved, then every member would be eligible. The other key to that is we've had some groups and organizations who had multiple offices. And so what we did, because this is area factor rated. So what we did was we went to the state and to the area that was the lowest area factor and set up the group there so that all the rates for every member across the country would be based on that lowest cost area factor. So that's one other idea that you can use. We have a couple more questions, but I'm going to keep moving, and then we'll stop in a moment and we'll answer some of these. So in addition to the plan benefits or the core of this product on the medical side, we have to have, of course, a Part D standalone prescription drug plan. These plans all work independent of each other, so you can put strictly the medical into this, or you can add the medical with the prescription drug plan, or you could set up a group just for the prescription drug side of it and not put on the medical. So again, these are standalone products. You can add where it's appropriate or not include if it's not appropriate. Now, if you look at the first two, the choice and the preferred, these are the lower cost options. Now, you'll notice that these plans are a little bit higher than what we find in the individual market. Essentially, that's due to the utilization that these plans have experienced over the years. You can see the PBM here is Humana. But the one product I really want to put your attention to is this Premier product. This is the one that makes Seniors Choice in their Part D very distinct because it is one of the only products we've found in the market that actually has a zero deductible and copays throughout the entire year. So this is not a product that you actually have to meet, get into the donut hole, get out of the donut hole or the coverage gap, and then get into catastrophic to find some additional benefits. This is going to give you strictly a copay. Regardless of the tier that you're taking a drug in, we have people who are taking extremely high-cost medications, thousands of dollars a month, that pay strictly a copay for that particular drug. So when you're dealing with larger groups, you may not necessarily know the health of all of the members or potential members or their spouses. So this Premier drug plan is very important to add to this product because, or make it available to this product. People don't have to enroll in this if they don't want to. They could go pick up a low-cost Envision RX for $14.60 a month and add that if they want. But if it's appropriate and the group has made this program available for those who are taking those high-cost drugs, they could, of course, enroll into the Premier and have those drugs covered with just a copay. The other nice thing you're going to find, because it is a high-cost option, but again, it's built for people who are taking a lot of high-cost medications. So ultimately, this would be a nice savings for them. The other thing you're going to find is even if it becomes like a break-even, okay, somebody gets into the donut hole, out of the donut hole, into catastrophic by, middle of the year, and based on the premium here, it becomes almost a break-even. Ultimately, what you're doing is you're spacing out their costs. For those people, they have to come up with thousands and thousands of dollars in just that first quarter to get themselves into the gap, out of the gap, and then into catastrophic. Well, in this case, you're going to spread that cost out. They're going to have their premium, and then they're going to have their copay, and it's going to be constant throughout the entire year. So that's another nice benefit to adding this program. Now, I did talk about premiums, and I don't know if there's a slide that gets into this, but as you'll find with the Seniors Choice product, the premiums can be, it can be employer paid. It can be paid by the members themselves. If, let's say, the employer doesn't offer any additional stipend or they don't pay for the retiree benefits, the individual can pay for this on their own. For large enough groups, we'll even split bill. So again, it can be very flexible even on who pays the premiums. Before I get into the next slide, let me just see if we have some answers to a couple questions here. Are you available in New Hampshire? I will have to look that up and see if New Hampshire is approved, Margaret. And so we'll probably come back to that. I believe it is. Actually, I just found it here. New Hampshire is available, so it is approved. We have another question. What are the qualifiers for additional skilled nursing coverage? Is this Medicare approved skilled nursing event? Yeah, so it's all based on Medicare. Medicare is the primary. So if Medicare approves somebody under the skilled nursing definition, then this plan would pay as a secondary. And is Humana the only PDP available? Again, that is the Seniors Choice product. And yes, Humana, they have a contract with Humana to be the PBM for their Part D for a few years. But again, you don't have to use these plans. We're just showing that they are available. You can sell a standalone PDP if that's in their best interest. Can this be carved into an existing plan, allowing employees over 65 to move? Yes, so this can come in. So I know the question earlier was, is there open enrollment periods? This can be sold throughout the year. A group can be established at any time. Individuals can enroll into this anytime. There is an open enrollment period at the end of each year, and all that's designed to do is allow the group to make changes to their benefits if they so chose to do that, whether it be offer a different Part D, whether it be add deductibles or copays if they didn't do that originally, or add one of those additional benefits. So the end of the year is the time the group can make changes, but people can enroll into these groups at any time throughout the year. There is no restrictions there. Okay, so we talked a little bit earlier about this, but again, there's a whole host of opportunities out there. Think of even yourselves. If you're currently sitting on this call and you're over 65 and you have an occupational license and you're an insurance agent or you have an LLC, you could actually sponsor this product today and you could put yourself on it, and that's all you need. So this product is very accessible to people. It makes it very easy to get a group involved. We've got tribes that have sponsored this, and their tribal members are members of this. We have associations. We've worked with credit unions. We've worked with tons of municipalities, small groups, large groups. You see real estate agents, insurance agents. We put that there because, again, with an occupational license, somebody could sponsor this program, and it would make them or their members eligible. Tax Equity and Fiscal Responsibility Act, TEFRA. Okay, I'm not going to get into too much detail here, but essentially what you're looking at is your guidelines are groups under 20, groups over 20. Okay, there are different rules for each. So essentially what you could do is if you had a group with less than 20 employees, and one of those individuals or more were full-time actives, and they were 65 or older, because this group would mimic and be the equivalent of their current group plan, especially with that premier drug plan attached to it because there's no donut hole, so it would be the equivalent to their current group plan, you could actually carve that person out. You could put them on Medicare A and B as their primary and add this Senior's Choice product as their secondary. So that would be legal. You could do that. For groups over 20, you would have to restrict this to only those who are retired, no longer working, or to individuals working less than 30 hours. So just in a nutshell, that's how the TEFRA, non-TEFRA works. For more details on that, we'll, of course, be following up with each of you, and Mark can answer those questions. So here's a quick example of what I just described. A group that we had, 10 employees, one was 65 or older. With this individual on their plan, it was $5,500 a month. We looked into removing that person. It dropped the premiums down to $400. They were able to take out the Senior's Choice. Medicare is primary, then the Senior's Choice is secondary. With the Premier RX, that was a $450 a month premium. So ultimately, that group saved $1,050 a month, $1,260 a year. Now, the other factor here is, what do most group plans have? So this person's 65 or older that was taken off this group. Well, they have deductibles. They have copays. They have a network to deal with. So they don't have the best coverage. They're stuck like many of us with, $10,000 deductibles or max out-of-pockets. So not only did it reduce the out-of-pocket expense and the cost to the group, it actually gave the the active 65-year-old, it gave them better benefits. They now had full coverage. They had A and B. With this program, they didn't see a dime out of pocket. So great solution for small groups in that sense. And then when you get into the large groups, you're dealing with a whole different world of things. But again, we can kind of talk you through those. But we have seen a number of groups with a huge savings. Some of these groups, some of these municipalities are still, self-insuring, or some of these groups have multiple plans because of union contracts and other things. We were just able to take a group recently of 50. There were 50 retirees. They had multiple Blue Cross plans, confusing. They were able to reduce that down to one option, the Senior's Choice program, with all the bells and whistles, and it saved that group $750,000 a year. And it gave their members or retirees better coverage. So, again, great solution for small, medium, and large groups. So very simple. You just get the trust participation agreement signed, and you just start to submit your enrollments once that group is approved. Again, no proof needs to come with those enrollments that that person is a member of the group. You just put the group number on it. If you have a large enough group, because it is mainly a one-page paper contract, if you have a large enough group, we have a spreadsheet that could be provided, and we will actually do the enrollments for you. And if for quoting purposes, you, once you're contracted, would have access to their quoting tool, we could show you how to do those quotes. And if, or, you know, you can, we have a quote request form you can send into us. We can, you know, once it's filled out by you, when you send into us, then we'll actually run those quotes and send them over to you. And the quotes can show all options, all benefits. Okay, so again, some of the plan highlights: guaranteed acceptance, works like a Medicare supplement, first dollar coverage if you so chose to do that, spouse can enroll, guarantee issue, groups down to one life, prescription drug plan with no coverage gap that will cover high-cost medications. We have another question here from John. So we're asked about Minnesota and Wisconsin. The answer is Minnesota is currently pending, and Wisconsin, yes, is available. So you could take groups and enroll them in Wisconsin. But again, you know, don't, for some of these states that may not be approved or are currently pending, don't be discouraged, because again, if you have a nice group and they can have that trust participation agreement signed in a state where this is approved, then even if the majority of their membership is in a state where it's not approved, you're good. You can still take that group. I'll give you an example of this. Is we have a tribe that is predominantly in the Dakotas, and this is not approved in the Dakotas. Well, they have another association that they're tied to in a state where it is approved. So that trust participation agreement was signed in that state where it is approved, but all those members from the Dakotas are being enrolled into this product. So again, it can become very flexible. But it is approved in, what did I say, Wisconsin. It is not currently, it is pending in Minnesota. Okay, so the next step here is, of course, getting contracted, being able to sell this product, and we can answer a couple more questions that are coming in. Though we had some technical difficulties, and Mark couldn't join us this morning. He was the one that was originally going to run through this with you. He will be the one to follow up with each of you, answer more questions, make sure you get your contracting and additional information on this product. One question, you had said earlier that the cost of the plan for a senior on Medicare would be around $130, $140 a month. However, you then showed that the cost would be $450 a month. I am confused. Well, Patrick, if you looked at the cost of that Premier Part D, which is around $370-some, that was added to that program. So that's where you're getting your additional $370 plus your $130. That's going to put you up to about $450. Okay, so that Part D is the expensive portion of this. But again, that Part D does not have to be sold with the medical side of it. On the medical side of it, you're going to be looking at a very traditional Plan F type premium. All right, so hopefully that answers questions. I will keep this open just for another few moments here. So if you have a question, please go ahead and type that in. And if you don't have a chance to ask, or you're not sure, if it's appropriate to ask, again, we'll be following up with each one of you, so we'd be happy to answer those one-on-one. I had an agent ask if we could provide this PowerPoint. Though we're not going to automatically send this out to everyone, if you would like this PowerPoint, we could absolutely provide it. Okay, so it doesn't look like any more questions are coming in. We appreciate you guys spending some time with us this morning. We know everyone's busy. Hopefully we showed you some nice opportunities and how this product could be used in your industry, or maybe even for something, if you're getting into this for the first time. Of course, we have some prospecting tools, marketing opportunities. We could certainly show you how to get into some of these groups. We could share with you the success stories of other agents and how they're doing it, how they're finding these opportunities. So whatever we can do to help make you successful in this group retiree space, that's what we're here for. So again, I appreciate your time. Everyone have a great rest of your day. This will be recorded, so we will make this available on our YouTube channel. That should be up in the next couple of days. And again, each one of you will be followed up with. So we appreciate your time, and you guys have a great rest of your day, great rest of your week. Bye now.